So we see a lot of patients here in our clinic who have what we call hypertonic pelvic floors. It's a fancy word that basically just means your pelvic floor is in a spasm. So when you think of a spasm, if you ever had like a neck spasm or like a spasm in your back, that's exactly the same thing that's going on, right? So typically the pelvic floor is supposed to relax and contract nicely, right? So during our physical exam with our patients, we'll ask them to do a pelvic lift, kind of like if you're holding in urine or a Kegel, we can feel that nice lift. So the muscles are contracting and then they will relax appropriately. Most of our patients that come through the door have hypertonic pelvic floor, which means the pelvic floor is in that spasm. So the muscles cannot contract and they cannot relax appropriately, which can lead to a lot of symptoms such as constipation, difficulty having a bowel movement, sharp rectal pains, urinary urgency, hesitancy, delayed urinary stream, that sensation of incomplete bladder emptying, painful intercourse, chronic low back pain, tail pain. So it can cause a lot of stuff that kind of, sounds and feels like it's something else. We don't typically think of the pelvic floor of causing all these symptoms, but it can. It's super important, right? And we all have a pelvic floor. So super important, if you're having any of these symptoms and you can't figure it out, come see your local pelvic pain specialist and, we'll take a look at your pelvic floor and see if we can help you.